Hi, I'm Dr. Jelin Isreal-Cvik with Premier MD Care here in Fort Myers, Florida. We're a concierge internal medicine practice, and I want to talk to you today about vitamin B12. I know that a lot of people talk about getting shots and taking the tablets, and I just want to talk to everyone about what vitamin B12 is and why we need it, why it's important, and if you're deficient, how to treat it. So first of all, vitamin B12 is a water-soluble vitamin that our body cannot make. We have to get it from a food source, and we'll talk about the food sources in a moment, but the importance of vitamin B12 in the body is that our body uses it to make our red blood cells, which carries oxygen to our body. It's also used to make the DNA in our body, which is very important, and it's also vital in cell metabolism. So the number of people affected with the B12 deficiency in the United States, if you're under 60 years old, about 6% of the population is affected, and over 60, it goes up to 20% of the population. So why is it that older people tend to be deficient in B12? Well, one of the risk factors for B12 deficiency is, like I said, you have to get it from your diet, is if you have a condition that could interfere with the absorption of the vitamin through the stomach and the small intestine. So sometimes as we get older, we lose the certain factor that's needed to absorb the B12 in our diet. Sometimes you might have a medical condition that prevents you from absorbing it. If you've had gastric bypass surgery, or if you have Crohn's disease or celiac disease, or even if you've been on certain medications for a long time, such as Nexium or Protonix or Prilosec, which is a very common over-the-counter antacid medication that we take, that can prevent and block the absorption of B12. Also, another common medication that people with diabetes take is Metformin. This also can block the absorption of B12. So there are many reasons why one can become deficient in vitamin B12. Also, if you're not getting enough in your diet, if you're a vegetarian or if you're vegan, there is no plant source of B12. So people who are strict vegetarians and vegans need to supplement the B12. So where do we get the B12 in our diet? The highest amount of B12 is actually found in clams. But you also find it in red meat and poultry and fish such as salmon and tuna. You can also get a little bit from dairy products like milk and eggs. An adult needs about 2.4 micrograms of B12 daily, but when we take something orally or as a supplement, only a portion of that gets absorbed. So that's why we take a higher dose when we supplement. So some of the symptoms of a low B12. I know some people think it helps to burn calories and boost your energy. It doesn't necessarily do that directly, but it can help increase your energy. So if you are deficient in B12, you can have a lot of fatigue. Another kind of frightening thing is that you can have memory loss. You can start to have some decline with the ability to retain information. And also another neurologic problem could be numbness or tingling in your feet and changes or loss in balance. So these are pretty significant symptoms that can come years after you've been deficient in vitamin B12. So it's good to treat it early on. The body is good about keeping enough stores in the body, in the liver, for 3 to 4 years before we start to actually become deficient. So the treatment for vitamin B12 is pretty simple. You can increase the foods in the diet that have B12. You can eat cereals that are fortified in B12. You can also take over-the-counter supplements. The ones that are sublingual, that melt under the tongue, go directly into the bloodstream, would be a great way to bypass the GI tract where the absorption might not take place. And for those who are severely deficient and are symptomatic, getting B12 injections is very beneficial. So vitamin B12 is an important vitamin, and it's something we do need to get from our diet. And if you feel like you have any of these symptoms, ask your doctor to check that for you.